Welcome back to the Neuro Way to Practice podcast. I'm your host, Dr. Ted Arkfeld, and today we're diving deep into the world of disc pathology. We'll be covering the anatomy of the lumbar disc, its innervation, mechanism of trauma, the role of the multifidus muscle, huge, and conservative chiropractic treatment options. Plus, we'll discuss how ARP neurological therapy stands out as a superior treatment for disc pathology. So let's get started.
This is the Neuro Way to Practice podcast with Dr. Ted Arkfeld. In each episode, he shines the spotlight on patients who have achieved amazing results the Neuro Way. Now, here's your host, Dr. Ted Arkfeld.
All right, let's start off, and we're going to be talking about the anatomy of the lumbar spine, which is your low back, and the disc in between each of the vertebrae. You have 5 vertebrae there. We number them from L1 to L5 for start, the top 1 all the way down to L5. As you'll see right here, there's a disc in between each of the vertebrae. It acts as a shock absorber. So if we move over to this view here, it's called the axial view. You'll see the outer part of the disc, that is called the annulus, and then you have the inner part called the nucleus pulposus. Right here is the spinal cord. Coming off the spinal cord is each of the nerve roots right here, which will go out and supply your muscles. It also sends information back into the spinal cord so it can go ahead and go on up into different parts of the brain, and a part we call the cerebellum, which is our posture, our balance, and our stability area. This is a cutaway of the vertebrae, the back part of the vertebrae that we call the spinous process. You'll see that over here on the left side. Right in here is where the multifidus muscle attaches to the vertebrae. The multifidus muscle is the most deep down muscle that's attaching to your spine. Let me go forward a little bit and I'll show you. Here is another picture of the multifidus muscle. So you'll see it's deep down in, attaches right to the vertebrae. I'll talk about its importance in just a little bit. So what happens when somebody herniates a disc or has a disc pathology? Well, many times I've had patients present and say, I was bending down to pick pickles up out of the refrigerator and I couldn't get up. Or I was putting my socks on and I couldn't get up. It was excruciating pain. We used to think of this as a strain, lumbar strain, where the muscles got strained. And we know now that that's not the case, that it is really a disc problem. You see, the disc is the most sensitive anatomical structure that can cause pain in your low back. You have an outer layer right in here. And the outer layer is many times like an onion. There's all these layers in there. Deep in there is a nerve. There's nerves that go all the way around the outer part. Now, when the disc is like this, there's no problem. All right. So what happens is that sometimes when somebody's in their 20s or 30s, actually we've even been seeing kids 16, 17 years old with disc problems. But there was some kind of an event and they couldn't move and it was excruciating. What had actually happened is there was a little fissure or a little tear in the disc. And when that happens, and if it gets far enough out, it starts to hit those nerves, and that's when you start to feel the pain. The other thing that occurs is that it will put off a chemical substance, a variety of them, that is just very irritating to this delicate nerves back here. It's just very irritating to everything. And so when it starts that process, that's where the excruciating pain comes in. Now, that will self-seal. If there's no further injury, that will heal up with the scar tissue. The issue, though, is that's not the original material. It's never going to be as strong. It's going to be prone to more injury. And so we know that Once you've had one episode, you're prone to have more episodes. And that's typically what I see in the office. Patients will come in with what we call hot disc because it had actually done this number. Okay, so there was more cracks, there was more tears, and now we get into a herniation, and it comes butting out right against that nerve root, and that sets pain going down the leg. It hurts to cough or sneeze. I mean, it's excruciating pain. But we know that if we can take and get the multifidus muscles, if we can get them strengthened, that is going to allow for them to stabilize the spine. So what I want to talk about right now is the true mechanism of injury, why this starts. And nobody talks about this. If you're getting laser therapy and spinal decompression, they are more interested in just getting you on the machine. And actually, let me show you what happens when you get on the machine. This is a decompression unit right here. And it's going to create a tractioning effect. Decompression is the effects of what we're doing on the vertebrae. So you're decompressing the disc that is angry, because that outer part is just, it's ramped up because those nerves are not happy at all. But what nobody talks about is what happened that excessive forces were transmitted to the disc in the first place. Well, what happened is that these muscles right here, the multifidus muscles, at some point became weak. And they can become weak because there's inactivity, there's a sedentary lifestyle, just a nervous system dysfunction. So the other issue with the current treatment approaches to a disc pathology is that, number one, they're not asking or telling exactly what the cause is, and two, they're coming from it from a purely mechanical or structural means. Whereas when we look at a disc problem, I'm looking at it from a neurological perspective. The nervous system did not function the way it should. And what happened is that these muscles, and there's special receptors in all of our muscles, are called muscle spindles. They detect the rate of stretch and the velocity of stretch. When those muscle spindles are not firing and they're not working like they should, these muscles will become resistant to stretch. When that happens, you can get a scar tissue, you can get atrophy, they get weak. These muscles are extremely important for the stability of our lumbar spine. They allow the lumbar spine not to slide forward and backward, or what we call shear forces. They allow the lumbar spine to be able to absorb the forces. Our muscles are designed to absorb loads and forces. And when the multifidus muscles can't do that anymore, guess where those forces and loads go? You got it. They go to the disc. And over repeated times, you're going to have a disruption in that disc, and it's going to create a problem, okay? We see a lot of patients that have gone through laser and spinal decompression, and they still are having reoccurrences because it doesn't stop the reoccurrences. Now, I'm not against laser and spinal decompression. They are effective in pain management, but they are not going to do anything from stopping reoccurrences because they don't address the real cause of the problem. Cause of the problem is right here, is the multifidus muscles. They are weak, they can't do their job, but more importantly, they fire to a part of the brain called the cerebellum. The cerebellum, again, is responsible for our posture, our stability, and for our balance. So let's talk about that. The cerebellum is responsible for making sure that we can fight the effects of gravity. And when you have a disc problem, you're losing that war. And no amount of spinal decompression is going to help you be able to absorb those forces because the structure is already, it's bad. You can't take a degenerated disc and make it look normal. You can't take a degenerated disc here. So watch this disc right here. You can't take that disc that's decreased because there's not enough water in there, and it has internal disruptions, and it's now a degenerative disc. You can't take that and turn it into that disc. That person is left with a structural problem of which there is no cure, but there is control. Now, one of the questions I often hear is, well, when do I get epidurals, or what's the value of epidurals? And having practiced in a pain clinic for 3 years and personally seeing the effects of epidurals, they are excellent for getting the inflammatory reaction down when this chemical substance gets released due to the disruption. Epidurals will not do anything for the structure. It is not a cure-all. It's just putting a Band-Aid on a painful situation, and it helps. They really do help. They take and get the inflammatory reaction down, and then we can come in with our Cox flexion distraction technique, a very gentle technique to the lumbar spine, and then we can do our ARP neurological therapy. So what does that mean? So when the multifidus muscles are weak and they can't do their job, they are not getting neurological stimulation. So we're going to pull our ARP neurological stem right alongside, put the pads on there, and we're going to hit them with 500 pulses per second. It's like a jolt, and it reawakens. It brings the system back online. So these muscles now are going to be able to do their normal stretching. They're going to be able to send their signals back up to the cerebellum to say, hey, things are working now. You're going to see better coordination, better balance, less pain. We're going to be able to get these joints moving properly, not through one crack, because that's not the technique you should be having when you have a disc problem, but a very gentle maneuver in order to get these joints moving, and that will get them firing up to the brain as well. You know, when you get every one of these joints moving, when you get these muscles that are resistant to stretch, when you get them back online, then you can move properly. But what happens is when you have this injury and there's pressure on the disc, you don't want to lean into that side because it hurts. So we often see patients with what we call an antalgia. They're leaning away from the pain. Well, eventually you keep leaning away from the pain, that posture becomes normal for you. And then you move away from the pain, and now you have an abnormal movement pattern. And if that keeps going on, that just sets the tone for future issues. You never really get to the cause. So if you want to get to the cause of the problem, we've got to work on these multifidus muscles. One of the ways that you can definitely tell, and I look when I have a new patient coming in with a disc problem and they've had an MRI, when I look at the MRI, we'll look at this axial image right here. Now this doesn't show the muscles obviously, but on the MRI, it'll be looking at like a steak. There'll be a lot of marbling or fat buildup, and that means that multifidus has atrophied and it's not doing the job. Until we get that multifidus muscle functioning, you're going to continue to have low back problems and reoccurrences and problems with your disc, and it can all be avoided. If this sounds of interest to you, give us a call, 989-448-8065. Set up a consultation. I'd love to hear from you, because you just don't have to live this way.